reporting from Fanshawe College. I'm here this morning. I would like to get to the bottom of why my friend Sabu is taking Enalapril and what Enalapril has to do with hypertension.
Blood pressure is the pressure of blood against the blood vessel walls as the heart pumps. When someone has high blood pressure, also known as hypertension, the heart and arteries have a much heavier workload. The heart has to pump harder, and the arteries are under greater strain as they carry blood. Having high blood pressure puts someone at a greater risk for stroke, heart attack, kidney failure, loss of vision, and hardening of the arteries.
Okay, so you tell me, why do you think you have a hypertension?
I am don't exercise like I used to, and I am doing very little, but it makes me shortness of breath, and I eat good. Probably I can eat better, I think. I am now in my late 40s. I have a little bit obese, I think. Moreover, my parents have hypertension. I think maybe it is it the genetic one?
Well, yes, those symptoms are definitely the signs of hypertension. Okay, Sabu, now I have to take your blood pressure, okay?
Okay. I will.
Okay, so your blood pressure is 150 over 128, which is a hypertension.
Oh.
So my suggestion is that you need to take this medication called Enalapril.
Enalapril. Okay.
Okay, Sabu, so now I am going to have you to go to the lab and have some blood work done. I would like to check your urinalysis, blood chemistry, such as potassium, sodium, and creatine, your glucose levels, triglycerides, cholesterol levels, and I will book you for an ECG. Okay, so now I'm going to tell you how Enalapril works in your body. So it is used to treat a disorder of the ventricles, and it can decrease the heart's ability to pump blood to the body. Enalapril inhibits ACE, which helps to lower the blood pressure, so it is used to treat high blood pressure. It also used to treat congestive heart failure. So now I will prescribe Enalapril 2.5 milligram 2 times per day for you.
High blood pressure is considered to be 140 over 90 millimeters of mercury or higher. Some nursing considerations that must be done when taking Enalapril is check the blood studies, neutrophils, decrease platelets, white blood cell counts with differentials to obtain a baseline. I need blood pressures every 4 hours. Electrolytes need to be checked, such as potassium, sodium, chloride, during the first week of therapy. Check patient for renal, hepatic, edema in the feet and the legs, also skin taggers, and check for dryness of the mouth or mucous membranes. Check for history of symptoms of congestive heart failure, edema, dyspnea, and wet crackles. Dyspnea. Rising blood pressure is associated with increased cardiovascular risk. Decreased systolic and increased systolic blood pressure can be affected by effects of someone's lifestyle changes, medical conditions, and just average aging. Okay, Sabu, your arteries are stiffening. Due to cholesterol buildup, you'll need to exercise. Change your diet and make sure you're taking your Enalapril as prescribed by your doctor.
As an assigned nurse, I will make sure to check my patient's blood pressure, orthostatic hypertension, syncope with diuretic, and check the pulse every 4 hours. I will also check the baselines of renal function before therapy begins, and will check electrolytes during first 2 weeks of therapy. And if his renal function is impaired, I will monitor for hyperkalemia. I will also check skin turgor, dryness of mucous membranes, and check edema in feet or legs daily, and will check any symptoms of CHF or skin disorders.
Enalapril pharmacotherapeutics. Enalapril is available in forms of 2.5, 5, 10, and 20 milligram tablets. A patient may be prescribed by mouth 2.5 to 5 milligrams per dosage to a maximum of 10 to 40 milligrams per day. The pharmacokinetics for enalapril taken by mouth is the onset is 1 hour, the peak is 4 to 6 hours. The duration is greater than 24 hours with a half-life of 1.5 hours. It's metabolized by the liver and excreted in urine. The following are some patient teachings when taking enalapril. Always take enalapril exactly as directed, even if you're feeling better. Report to your doctor immediately if you're experiencing chest pain, irregular heartbeats, palpitations, signs of angioedema, swelling of the lips, face, tongue, or hands. During the first few days of therapy, enalapril may cause drowsiness, dizziness, fainting, and/or lightheadedness. Contact your physician or doctor if your cough is persistent. Do not take over-the-counter medications such as cough, cold, or allergy medications until you talk to your doctor to avoid potassium and salt substitutes. Avoid sunlight or wear sunscreen for photosensitivity. A fall in blood pressure may be due to excessive sweating, dehydration, vomiting, and diarrhea. Contact your doctor if any of these occur and stay hydrated. Do not discontinue enalapril abruptly. Enalapril may cause skin rashes. Cardiovascular adverse reactions may reoccur. Rise slowly to sitting or standing positions to minimize orthostatic hypotension. And notify your doctor if pregnancy is planned, and do not take if you're breastfeeding.
Side effects include tinnitus, double vision, dry burning eyes, cough, dry mouth, sore throat, dyspnea, crackles, and edema, loss of taste sensation, loss of appetite, dizziness, drowsiness, headache, paresthesia, fatigue, anxiety, insomnia, nausea, vomiting, colitis, cramps, diarrhea, constipation, flatulence, skin itching or rash, purpura, hyperhidrosis, photosensitivity, hyperkalemia, hypertension, chest pain, tachycardia, dysrhythmias, syncope, angina, and myoorthostatic hypertension, proteinuria, renal failure, increased frequency, polyuria or oliguria, agranulocytosis, neutropenia, Contact physician if you are experiencing any of these side effects.